Obesity in the United States is a growing epidemic. Over 42% of adults are living with obesity, and this number is continuing to rise. But obesity is not just about weight. It is a major contributor to some of the most dangerous chronic diseases we face today, including heart disease, type 2 diabetes, and certain forms of cancer. These are life-altering, often life-shortening conditions, and yet they are affecting millions of Americans every single year. But here is something many people do not realize. Where you live can have a huge impact on your health. Access to food, exercise, healthcare, and even education varies dramatically depending on your zip code. And while obesity is a nationwide issue, some states are facing it more severely than others. Today, we are breaking down the top 5 most obese states in America, based on the latest CDC data, and we are going to explore what is really driving those numbers. Spoiler, it is not just about food or personal choices. The full story is much more complex. Let us begin with number 5 on the list. Alabama. As of the most recent data, Alabama has an adult obesity rate of 39.3%. That means almost 4 out of every 10 adults in the state are struggling with obesity. This is not a sudden trend. It has been building for decades, and it is rooted in a combination of socioeconomic, cultural, and infrastructural issues. First, there is poverty. Alabama consistently ranks among the poorest states in the nation. Nearly 17% of Alabamians live below the federal poverty line, which impacts everything from housing and employment to nutrition and healthcare access. For low-income families, fresh fruits and vegetables often cost more than processed, calorie-dense foods. When your grocery budget is stretched thin, you buy what fills you up, not what keeps you healthy. Then, there is access. Alabama has many rural counties where food deserts are common. A food desert is an area where people cannot easily access affordable, healthy food options. Instead of grocery stores, many small towns have corner stores and gas stations. That means packaged snacks, sugary drinks, and microwavable meals are often the only options within reach. Physical activity is another factor. According to CDC data, nearly 30% of adults in Alabama report getting no leisure time physical activity. That is a huge problem, and it often stems from environmental barriers. Some communities lack sidewalks, lighting, or public parks. There may not be a gym or recreation center nearby. If you do not have a safe space to walk or work out, it is much harder to stay active. Cultural traditions also play a role. Southern cuisine is famous for being rich and flavorful. Fried chicken, barbecue ribs, biscuits and gravy, sweet tea. These dishes are delicious, but they are also high in calories, saturated fat, and sugar. In many households, these meals are staples. They are tied to family traditions, holidays, and social gatherings. This is not about blaming culture, but understanding how it influences long-term eating habits. Next up is number 4, Louisiana. Just ahead of Alabama, Louisiana's adult obesity rate currently stands at 39.9%. Like Alabama, the state faces deep-rooted challenges when it comes to poverty, access to healthcare, and public infrastructure. But Louisiana also has some unique circumstances that affect health outcomes. One of the biggest challenges is food access. Many Louisiana residents, especially in rural parishes, live in areas where healthy food is scarce. This is particularly true in places like the Mississippi River Delta or north central Louisiana. Residents in these areas often rely on convenience stores, fast food chains, or dollar stores to feed their families. The nearest full-service grocery store might be over 20 miles away. In cities like New Orleans, food insecurity is also a major issue. Despite being an urban center, the city has neighborhoods that are considered food swamps, areas with high concentrations of fast food and processed snacks, but few healthy options. And even when healthy food is available, it might not be affordable. Healthcare access is another major problem. Louisiana has one of the highest rates of uninsured residents in the country. Even after Medicaid expansion, thousands of people still fall through the cracks. Without regular doctor visits, many chronic conditions, including obesity-related issues like hypertension and diabetes, go undiagnosed or untreated. There is also the stress factor. Louisiana has one of the highest rates of natural disasters, including hurricanes and flooding. Disasters displace families, destroy infrastructure, and create trauma. Long-term stress is a known contributor to weight gain, particularly through hormonal changes that impact appetite and fat storage. And like Alabama, Louisiana's culture is rooted in rich, comforting cuisine. Gumbo, edifi, red beans, and rice. These meals are steeped in history and identity. They are delicious, but not always healthy. Changing dietary habits is difficult when it means changing culture. That is why any solution has to come from within the community, not be imposed from the outside. At number 3 is Arkansas, where the obesity rate has reached 40%. That means 2 out of every 5 adults are living with obesity. Arkansas faces many of the same issues as other southern states, but with its own unique challenges. A large portion of Arkansas population lives in rural areas. These communities are often cut off from essential services, including medical care and grocery stores. In some counties, there is only one doctor for every few thousand residents. That makes preventive care incredibly difficult. If you are not getting regular checkups, it is easy for weight gain to spiral into obesity, and then into diabetes or heart disease. Public transportation is also limited. If you do not have a car, get into a store or a clinic can take hours, or may be impossible. People end up relying on whatever is nearby and accessible, even if it is not nutritious. Education is another important factor. Arkansas ranks near the bottom nationally in terms of public health funding and school performance. Health education is limited, both in schools and in the community. Many people have not been taught how to read nutrition labels, how to cook with fresh ingredients, or how to structure an exercise plan. It is not about willpower, it is about access to knowledge. There is also a mental health component. Arkansas has a high rate of anxiety, depression, and substance use. Mental health is often underdiagnosed and untreated, especially in men. People turn to food as comfort. It is a coping mechanism in a system that has not provided better alternatives. Moving on to number 2, Mississippi. With an obesity rate of 40.1%, Mississippi is ranked near the top 4 decades. It has one of the highest poverty rates, the highest diabetes rate, and some of the worst health outcomes overall in the nation. What makes Mississippi unique is how deeply the health crisis is tied to racial and economic inequality. Black residents make up nearly 40% of the population and face significant disparities in income, healthcare, access, and education. Historically, black neighborhoods have been underfunded and underserved for generations. These inequalities are baked into the system, and they are reflected in obesity rates. Mississippi's healthcare system is severely under. Rural hospitals are closing. Primary care doctors are scarce. Preventive care is almost non-existent in some areas. People often do not seek help until they are already very sick. Many towns in Mississippi are food deserts or food swamps. Families rely on drive-thrus, frozen meals, or cheap packaged foods from gas stations. When you add in long work hours, low wages, and high stress, there is almost no room for healthy living. Even when people want to make a change, the support is just not there. Education is another factor. Mississippi has some of the lowest literacy and graduation rates in the country. Health literacy, meaning the ability to understand and act on health information, is a serious barrier. Without good information, people cannot make informed choices. And let us not forget about the cultural context. In Mississippi, like much of the South, food is love. Food is tradition. But when those traditions include fried catfish, sweet tea, or 3-cheese casseroles, the results can be devastating without balance. And finally, at number 1, West Virginia. This state has the highest adult obesity rate in America, currently at 41.2%. Nearly half the adult population is affected. It is a crisis that touches nearly every community in the state. West Virginia has struggled with economic hardship for decades. Once a hub for coal mining and manufacturing, many of its industries have collapsed. That has left behind poverty, joblessness, and isolation, especially in the Appalachian region. More than 40% of West Virginians live in rural areas, where access to food and health care is minimal. The state also has the highest rate of diabetes in the U.S., and one of the highest rates of prescription drug use and addiction. There is a deep connection between mental health, economic stress, and physical health. People who are struggling emotionally often turn to food as a source of comfort or control. West Virginia also has aging infrastructure. Many roads are in poor condition. There are not enough sidewalks or bike paths. People cannot easily get around without a car. And in some towns, there are no grocery stores at all. Just a single dollar store and a fast food restaurant. But what is perhaps most heartbreaking is that West Virginians are trying. There are community gardens, there are local health initiatives, but change takes time, and it takes resources that are in short supply. So what do all these states have in common? Alabama, Louisiana, Arkansas, Mississippi, and West Virginia are not just the most obese. They are among the most economically disadvantaged, medically underserved, and geographically isolated. This is not about laziness or lack of willpower. It is about systems. It is about decades of disinvestment, discrimination, and neglect. If we want to reduce obesity in this country, we need to stop blaming individuals and start changing environments. That means improving schools, expanding healthcare access, building walkable cities, and making healthy food affordable and accessible to everyone, not just the wealthy. Until then, the obesity epidemic will continue, not just in numbers, but in lives lost and communities broken. Thank you for watching. If this video helped you see the bigger picture, please like, share, and subscribe. This is not just about data, it is about people who deserve better. Until next time, take care of yourself and take care of each other.